Boa tarde a todos. Good afternoon to everybody. It's a pleasure to be here with you in this webinar that will be discussing a very, very important topic, that's medical cannabis clinics, a new growing business in the cannabis industry. I'm Rogerio Rabelo. I'm chairman of the Health Innovation Committee of the Brasil-Canadá Chamber of Commerce, and it's a pleasure to be with you in this wonderful team of speakers to discuss such an important issue here, not only in Brazil, in Canada, all over the world, that the medical use of cannabis. And I'm sure this webinar is going to clarify a lot of doubts, and it's going to show the importance of this topic to be approached more and more here in Brazil, as well as it has been approached and discussed and implemented in Canada. I'm going to start sharing my screen with you to give you a little bit of background on the Chamber of Commerce and the Health Innovation Committee. It's quite interesting for those of you that don't know, the Chamber of Commerce Brazil-Canada is active since 1973. And it has a binational and multi-sectorial approach in order to bring together companies, sectors, universities, research, innovation from Canada and Brazil. Only to give you guys an idea, it has not only a strong geographical presence both in Brazil and in Canada, but every year it organizes, and of course this year was an atypical year, so a lot of those events became webinars, and we use technology to put people together and companies together. But last year it had the 8 trade missions to Canada and Brazil, Canada, Brazil, 83 events and more than 50 market studies. And this is going on also this year, mainly using Zoom and other several tools that you can use to make ourselves comfortable together and safely together in this isolation period, and also road shows in Brazil and in Canada. And the Chamber of Commerce has several commissions, and these webinars being hosted by the Health Innovation Commission, that it's one of the committees of the Chamber, where the mission is to connect researchers, business institutions, and startups in Brazil and Canada to maximize what we can do in health and business between Canada and Brazil. Our objectives is to generate relevant content both in Brazil and Canada in the area of health innovation through seminars, webinars, publications, and in-person events, as soon we can have them again. Force academic research, expand network, and of course identify business opportunities for our companies both in Brazil and in Canada. I'm co-chairman together with Luis Sergio, and Claudia Ramos is our business development, and she is available for any of you that are watching this webinar, have interest to get to know more about the Brazil-Canada Chamber of Commerce, how it can support your business, how you can become a member of the Chamber of Commerce, as well from the Health Innovation Commission. And medical cannabis is very important for us, and we've been approaching this topic since last year. We had in 2019 a symposium held on this old, very, it seems today, old times where we can all be together in a big auditorium to discuss relevant topics. So this was 2019. This year we're doing webinars, and it's working wonderfully. This is one of the several webinars organized this year. And but hopefully next year we're going to be able to also host live webinars with everybody together to do person-to-person networking. And cannabis was approached in very good depth in this event. And in the Chamber of Commerce website, we have a very interesting publication, both in Portuguese and English, called Revolution in Health. And cannabis was approached as a thriving market, with several very interesting discussions that are being published there if you are interested to go deep into it. And this year we started with our magazine Explore, and the first edition also had a very important article on cannabis, and rehabilitation here is to show how cannabis, medical cannabis, can be used, and it's very important. We are going to use this webinar for sure to make very clear the opportunities here and the facts and the truth about the correct use of medical cannabis, and get away from the myths that sometimes surrounds this topic. That's going to be a very important discussion. And for that, I'm gonna invite Ricardo Meirelles. He lives in Canada, but he's Brazilian. He is part of the RM Consulting and several other firms. He provides advice. He's also part of Point Click Care, medical electronic record and electronic record for elderly care homes that is very big in Canada and the United States. And Ricardo is gonna host this event with the very interesting speakers that you're gonna get to know, and Ricardo will do the presentation afterwards. And Ricardo has a Master in Business Administration from University of Florida, Executive MBA in Finance from the IBMEC in Brazil, and also a Bachelor in Engineering from the Catholic University in Brazil. So Ricardo, it's a pleasure to have you with us today. You are also a very important member from the Health Innovation Commission from the Brazilian Brasil-Canada Chamber of Commerce. And they were very, very important to put together this very, very interesting webinar. And now I'll invite you to join our virtual webinar and lead it from here. Thank you very much and enjoy the webinar.
Thank you, Rogerio. It's been a pleasure to work in the Health Innovation Committee with CCBC, and I am sure that we'll be working on other very interesting events just like this one together that will come in the future. I would like to take a minute here to introduce our two panel speakers today. Marcelo Grecco, co-founder of the Green Hub, and Rattan Panesar, president of CannaWay Clinics. And as Rogerio said, we are going to be discussing the medical cannabis clinics. This is an area that is growing fast in Canada and have already started here in Brazil. And a very promising market and opening, I would say, hope for people who don't have hope and bringing better outcomes overall. So with that, I would like to ask Rattan and Marcelo to talk a little bit about their organizations, the successful of these organizations, their corporate presence. So I think, Marcelo, we could start with you if you want to share some materials and talk a little bit about the Green Hub. And after that, we pass about the voice for Rattan. Okay?
Of course, of course. Thank you very much for the introduction. And this is also a special day that we're doing this live. Today, from today, cannabis is no longer classified as a dangerous drug. It was unclassified by the UN Narcotics Commission. So it just happened today, this morning. So it's a very important moment for us and for this discussion. It's just a beginning. It's just a small step because there's still a long way to go, but it's still very, very important. I'm going to share my screen here with my presentation to talk a little bit about Can you guys see my screen?
Yeah, I can.
Yes.
Perfect. Perfect.
All right. Well, so I'm co-founder for the Green Hub. We started to work with cannabis back in 2016, and the story for that was we had a group of moderators here in Brazil that were fighting to get access to cannabis back then. They started going to Anvisa, our local FDA, to start to have access, at least to import the medication from the US or from Europe. And it was really hard at the time and really difficult to have that access. So at the time we saw that pain, and then we started our project. So what we say here is that we're passionate about innovating, connecting, integrating good ideas that can transform and impact changes in the world. That's exactly what it is when we talk about health and when we talk about mothers fighting to give their kids access to cannabis for epileptic reasons and other reasons, autism and etc. It's really important to have good projects. And this is how we started. So we call the Green Hub, we're a hub for innovation and technology focused on the cannabis market. So we built a network focused on innovation and technology, entirely focused for that sector. So we're investing, we started investing in data, and then our focus is to connect the world, bringing information to Brazil for entrepreneurs, for the corporate sector, for academia, and for government, for investors. So that's how we started. We didn't have any projects at the beginning. We started with a portal, exactly talking and bringing information of everything that was happening around the world. And then we were, one of the first partnerships that we did was with New Frontier Data, a company from Washington, D.C. in the U.S., and we launched two reports, one on the medical cannabis market for Brazil, and another report for the regional report for the Latin America market. With that, we started, making people look at cannabis in a different way, knowing that it was something that could grow, something that could be important for Brazil. But one of the first decisions that we took is that we wouldn't touch the plant, and that decision made us what we became at the time is that we became an accelerator. And the first venture builder that we had, the first project that we had was SEC. It's the Center for Cannabinoid Excellence. We founded SEC back in 2018, and SEC is a project for clinics. So here is written in Portuguese, but it's the first center of excellence. It's the first clinic 100% specialized in the cannabinoid treatment here in Brazil. So with SEC has a complete and unique design structure in education, personalized medicine. So we act in 4 areas of expertise. We have SEC Medical, where we do all the treatments. We have SEC Learn, where we give a free education to any doctors or patients that want to know more about the endocannabinoid system and cannabinoid treatments. We have SEC Academy, which is it's a marketplace for people that want to train teams, pharmaceutical companies, hospitals that want to train their teams to understand better about cannabis. It's SEC Academy. Now we're launching in 2021 a physical actual school for training. So it's going to be a SEC Academy. We're going to have our own place. It's not only going to be online, but it's going to be physical as well. And SEC Science, where we want to bring a vision of quality. There's a lot of products that come into Brazil as access, and we don't know exactly the quality for those products. And before we give them to the patients, we like to go over the quality and do some research on the quality of products. So here in Brazil, we have 2 forms of access. We have RDC 335, which is the import of medical cannabis. Any Brazilian citizen can import any cannabis products to treat their health. So Anvisa provides protocols required for authorization and import of cannabis to meet step-by-step for registration in the request of the Anvisa website. So you need, in order to get the medication, you need a medical consultation, a medical prescription, and a disease report and disclaimer. The patient gets in contact with Biological Life and register with Anvisa. they get orientation for the acquisition and purchase of the product. And then they release a permission so the patient can have the medication delivered at home. The other RDC that we have for access is the new one that just happened in December. It's RDC 327, which you have to have a special authorization. And then you have to have certificate of good manufacturing practice, GMP. You have to have a good drug distribution storage practices, technical and scientific rationale for cannabis products, technical documentation and product quality, operational conditions to perform quality control, the ability to receive and handle reports of adverse effects and technical complaints, and the knowledge of the concentration of the main cannabis present on the formulation. So RDC 327 pulls up the bar and then makes Anvisa one of the sanitary, one of the most, the biggest one in the world, that raised the bar on cannabis and is treating cannabis not only as a supplement, but as a medication-based in cannabis products. I bring here, for the ones who know, an example. So you have to have a report, and then you also have to have a prescription sent to Anvisa in order to get that authorization. So this is on the 335. On the 327, on the other hand, you can buy it in the drugstore, but you also will need to have the report and the prescription. So we don't have that much time, so this was a fast overview, but we're going to have the opportunity to talk a little bit more and answer some questions.
Fantastic. Thank you. Thank you so much, Marcelo. So in the same way, I would like to ask Rattan to give an overview of the CannaWay Clinics and tell a little bit about your presence in the market.
That was a very informative presentation, Marcel. Thank you. And thank you for the introduction, Ricardo. I'm just going to share my screen real quick here. Okay, so so today I'm just going to provide you, a brief overview of CannaWay Clinic, and then I'm going to touch on a little bit of why cannabinoid medicine, what are the major cannabinoids, how we're consuming them, and some of the conditions that we're treating with them. And as Ricardo mentioned, I am the president of CannaWay Clinic. So to start, I think it's a good starting point is just to provide an overview of CannaWay Clinic. We are a physician-led network of medicinal cannabis clinics throughout Canada, and a little bit of the history of CannaWay is that we did start our clinics in March 2018, and within a year we were able to grow to 5 standalone locations throughout the Toronto area, and now using telemedicine in our standalone clinics, we are assessing patients from 5 different provinces. And our goals for 2021 are to be coast to coast, so across Canada. Our primary focus at CannaWay, or our mandates are, to increase access for patients and physicians, to increase education, not only for the medical community, but also the non-medical community, and then moving forward with research and development. Over the last 2.5 years, we've assessed almost 13,000 patients, and we've amassed a referral network of around 900 physicians. And I think just for context of the history of medical cannabis in Canada, at least, I think it's important that we see this slide and we know that cannabis or medical cannabis has been prevalent in society for thousands of years. But what I really want to focus on is 1930 to 2001 in Canada, where it was prohibited. So there was a lack of research and development for medical cannabis, which really has set us back now, several years. In 2001, medical cannabis was legalized in Canada. And in 2018, it was legalized for recreational purposes. As you can imagine, in 2001, the regulations and policies aren't what they are today. They've evolved over time, which has facilitated CannaWay Clinic in achieving our mandates. So it really brings us to, why are we speaking about cannabinoid medicine today? It's obviously a prevalent topic in Brazil as it is in Canada. Firstly, as we saw in the previous slide, cannabis has been prevalent in society for thousands of years. And as I speak to you today, there are a number of large academic institutions in Canada and really across the world that is conducting research looking at the cannabinoids at a molecular level. And really when we start looking at the physiology of the plant and some of the molecules of the plant, it does bring a legitimacy to this area of medicine. We have been using synthetic cannabinoids, Navalone, Sativex for many years. They have been let with limited efficacy, side effects are sometimes intolerable, can be expensive, and the availability is not always the best. In Canada or in North America right now, we are in the midst of an opioid epidemic. Around 115 Americans are dying every day from an opioid overdose, and around 15 Canadians. And what we've seen in CannaWay, the research that's been published is very well aligned with what we're seeing in CannaWay. When we have patients who are habitual or long-term opiate users, and we introduce medical cannabis into their treatment plans, we're seeing within 6 to 12 weeks that they've already started to reduce the amount of opiates that they're taking, and we've also been able to wean patients off of opiates altogether. And as I mentioned, in 2018, cannabis was legalized at a federal level in Canada, and since then, it has obviously brought cannabis to the forefront. It is a water cooler topic, although maybe not right now with the pandemic, but regardless if you're on the internet or you're at a bus stop or you're reading a magazine, you're going to see something regarding medical cannabis, and that has helped drive our business forward. And really, why cannabinoid medicine? I think it can be summed up in that, it is an alternative treatment option for patients, and we are providing hope, as Ricardo mentioned, to patients who, they've been suffering with their chronic illness for many years with no symptomatic relief. And we're able to achieve some symptomatic relief and increase quality of life in some of these patients. And I just wanted to touch on the major cannabinoids. There is a lot of misconceptions and stigma associated with cannabis. So I thought if I touched on maybe the differences between THC and CBD, it can put things into a little bit of perspective. So first, let's talk about THC. It's really the more popular component of the cannabis plant. It's well known for its psychoactive effects. It's the component of the plant that makes you feel high or euphoric. In the clinical setting, we are using it to treat neuropathic pain, muscle spasms in MS patients, stimulating appetite, and controlling nausea in cancer patients. THC definitely has a role in the clinical setting. It's typically at lower doses, so sub-therapeutic doses, because we know it works synergistically with CBD. CBD is the major player in the clinical setting. It has been shown to be non-psychoactive. The WHO, or World Health Organization, has stated that it is non-addictive, and we're using it to treat a variety of different ailments and conditions. It does have anti-inflammatory properties, analgesic, anti-nausea, and anxiolytic properties. So as you can imagine, as it does have a variety of different properties, we're using it to treat quite a spectrum of conditions. We're typically treating, majority of our patients do present with chronic pain. As you can imagine, patients who have chronic pain for 10 or for extended period of time also present with insomnia and anxiety. So those are our top 3 conditions that we see. We also treat quite a few fibromyalgia patients, headaches, rheumatoid, and osteoarthritis. So, now we know the major cannabinoids, THC, CBD. We now know a couple of conditions that we're using cannabinoids to treat. So then the question arises, how do I take this medication? This is not like taking an aspirin or Tylenol or Norvasc. There's no standardized doses. So there's really two methods. You can either inhale the product or you can ingest the product. About 5% of our patients are inhaling their medical cannabis. We do not recommend combustible forms, so we don't recommend smoking cannabis. If they're to inhale, they would use a vaporizer. It does allow for rapid absorption, and like with most things associated with medical cannabis, the long-term effects of using a vape are really not known. Because of its rapid onset, we're using it to treat acute conditions such as migraine headaches, panic attacks, etc. Majority of our patients at CannaWay are ingesting their medical cannabis through an oil formulation. It does have a slower onset of action, and with our patient demographic, with the average age being around 60, majority of our patients have never used cannabis before. There is definitely less stigma and less barriers to use when introducing an oil to our patients. It's also easier to dose and titrate. And as you can see on the slide there, we are using it to treat a variety of conditions ranging from chronic pain to epilepsy to anxiety disorders, and then also spasticity in neuromuscular conditions. So, as I mentioned, there's no standardized doses. So, the motto is start low and go slow. So we start at low doses and we increase it slowly until the patient gets into a therapeutic range. Over the last 2.5 years, we have seen significant improvements on our end in being able to start maybe at a dose that's closer to their therapeutic range, and we are compiling data. So in terms of dosing, we are collecting about 100 data points per patient. So over the 13,000 patients that we've seen, we know that if this patient A is having really good outcomes and they've decreased polypharmacy, they've decreased, some of the other medications, increased quality of life, we know exactly how many milligrams of CBD and THC are associated with some of those positive outcomes. That was just a very brief overview of CannaWay Clinic, and just to summarize, we do know cannabis has been prevalent in society for many years. The major components are THC and CBD, the main one being CBD, which is non-psychoactive and has a variety of different effects from being anti-inflammatory to anti-anxiety. And we're using it to treat, a wide range of conditions. And we're not promoting smoking cannabis, rather ingestible forms. And moving forward, as we progress into the future, we'd be looking at not only oils, but sublingual strips, topicals, patches, and so forth. So I think that brings me to the end. So just want to thank you for your attention.
Thank you so much, Rattan. Excellent, and thank you, Marcelo. Okay, so I think I would like to bring here some questions that I have to the both panelists. And I would like to start with something. Always when I see leading organizations like you both have, I step back and I think, what's the why behind this organization? What was the opportunity? What was the gap in the market that these both leaders, Marcelo and Rattan, saw, and they built these organizations to address this gap in the market or to address this opportunity? So in Marcelo specifically, this new initiative that the Green Hub has, which is the second initiative. So I would like you guys to spend some time sharing with us the why behind your successful organization. And I would start with you, Rattan, if you can talk a little bit about that.
Great. So as I mentioned in my brief presentation, that medical cannabis has been legal in Canada since 2001. The policies and regulations surrounding medical cannabis have significantly improved. In 2001, it was very difficult. There were a lot of hoops to jump through for a patient to obtain a cannabis prescription or even a medical cannabis consultation with limited products available. So as the policies evolved over time, it did streamline it and make it more easier for patients to access cannabis. So essentially what CannaWay has done is, implemented some of these policies into practical application, i.e. our clinics. And our clinics were created to really address three main concerns or three major issues. One is providing access. We strive to provide access for both patients and the medical community. Number two would be education. There is a lot of stigma and a lot of misconceptions regarding medical cannabis. Even to this day, when you speak to physicians in Toronto, a lot of them are hesitant because they think their patient is going to get high. So one of the mandates for CannaWay Clinic is to educate not only the medical community, but also the non-medical community. And then number three, I guess the third pillar of CannaWay, or the third void that we are trying to fill, is research and development. As I mentioned, there was a time period of prohibition, which lasted almost 70 years, which we weren't able to run large-scale clinical trials. We weren't able to develop standardized doses for treatment plans. At CannaWay, we are collecting data points on all of our patients. And as I mentioned in the presentation, we can tell you at, for example, 43 milligrams of CBD and 3 milligrams at THC, that patient who had chronic pain for 15 years is now able to decrease their Percocet dose in half, discontinue their sleeping medications, and cut their anxiety medications in half. So these are sort of the data points and the voids that CannaWay strives to fill. One, access to education, and three, research and development. That would be the why for CannaWay Clinic.
Fantastic. Thank you, Rattan. Marcelo, it's the same, and focus on the SEC, which is a great initiative that the Green Hub has started this year in Brazil.
Exactly. I can say the pillars are really similar to Rattan's and CannaWay, because we always look into the first, and one of the most important things is education, because without education, it's hard for patients and even doctors understand what's happening, the changes. So cannabis was prohibited for a long time. I think we're gonna reach a point that we're gonna in 5 years or 10 years, we're gonna surpass those 80 years of prohibition. But at the time, one of the most important pillars is education. But there's two different whys on our project. In the beginning, it was one, and now we have 5 years later, we have different one. So in the beginning, it was, as I told you, we had the RDC, the 335 was launched. It was another RDC, and it was harder for mothers and for patients to have access to cannabis. So the why back then was to exactly bring, a way that people could find doctors that could prescribe. It was really hard back at the time to find doctors that were willing to prescribe. It was only, a few neurologists, and it was really complicated to find the number. It's still not the number that we want, but back then it was even harder. So our why at the time was to help not only those mothers that were fighting with Anvisa to get access, but give access to other mothers that started seeing that happening. Today, what we see is that the evolution of cannabis it's growing. People are understanding more. We have new other companies giving education. We have 150% more doctors prescribing. We have an understanding of everything. So now what we need to do is exactly go on the other way, understand which are the best treatments, the best forms of treatment. It's something really. I think cannabis is not a treatment that it's gonna be the rest. It's gonna be only, go to the drugstore and buy a medication behind the counter. I think it's gonna be, you're gonna need to understand people's DNAs and how people react. The way Ricardo reacts to one type of cannabis is the same. It's a different way that Marcelo and Rattan is gonna react to the medication. We see that it's not only prescribing. After prescribing, it's following on the treatment, seeing how the patient is reacting, seeing if you need to change the medication or the dosage. So it's a different way of it's a different way of clinicking. So our why right now is to to make more. In the beginning was to give more access, but now it's to give more access, but bringing new studies, new technologies, new researches, and go with that.
Fantastic. Thank you, Marcelo. My next question here would be about the doctors. How are they are getting involved with the medical cannabis clinics? And for instance, patients being referred by physicians? And Marcelo, you touched something very interesting when you talk about follow-up, how those clinics are following up with the treatment that they give to the patients. So Rattan, I would like to start with you and ask how you see in Canada that physicians getting involved, the patients being referred, and things like that with the clinics.
Right. So, I think there's 3 ways that patient or physicians can get involved in medical cannabis. At a high level, it would be 1, referring their patients to a clinic like CannaWay. Number 2 would be undergoing the proper training in learning the interactions and how to prescribe. CannaWay does offer training programs for that too. So it would be 1, referring; 2 would be prescribing. And I guess the third way that physicians can get involved would be through participating in our continuing education seminars. Ours and other companies also have continuing education seminars, and then integrating that knowledge into their medical community and sharing it with their patients. And in terms, I know you mentioned the importance of follow-ups. A proper medical cannabis clinic will have very steady and timely follow-up appointments. Typically at CannaWay, where we'll see a patient, sometimes 3 to 4 weeks after their initial consultation, and then sometimes 6 to 8 weeks, and we follow that patient throughout the year. And that also is an additional touch point of how physicians get involved, because every time we see a patient, we do send them a consult note. And a lot of times, that's how we've been growing our business. A lot of times physicians are on the fence with respect to referring. We'll give it a shot, and that patient does well. The physician reads the note, and then they start referring more patients with similar conditions. But again, at a high level, there's really 3 ways: participating in seminars, referring patients, and then also prescribing after you've undergone the appropriate training.
Fantastic. Thank you, Rattan. Marcelo, would you like to expand on this point, how the doctors are involved, and perhaps specifically with the SAC initiative, but overall how they are involved in the medical cannabis?
I think it's not about, in the beginning, people were saying that doctors, they didn't want to prescribe or didn't want to get involved into cannabis or prescribe cannabis, let's say. But today I see that's not really what happens. I think in the beginning, everything started with the US, with adult use and everybody thinking, with the adult use had, and at the time, they weren't involving doctors, bringing doctors to the conversation. I think right now, more people are bringing doctors and asking doctors questions and involving doctors and scientists in the matter. And I think that's reflecting positive on the market. I see many more doctors. Here in Brazil, we have over 500,000 doctors. And we don't need to expect those 500 doctors to be prescribers. We need to have more doctors prescribing, and we need to have universities teaching the doctors that want to get involved more and want to prescribe, understanding the endocannabinoid system. So I see a growing number of doctors wanting to participate in the market, and one of the reasons is that people are basically with COVID, what we saw is that it became something that you couldn't close dispensaries, and it became something that people looked for health. And even if they wanted to relax, people were looking for doctors before they were going to dispensaries and buying anything. And I see more people looking into cannabis as to solve health issues rather than just to use it in the recreational levels. So that's making doctors come closer and wanting to understand the market better. And I see it in a positive way. I see an increasing number of doctors, especially here in Brazil.
Perfect, Marcelo. Thank you. Another point, since I talked about doctors, now I want to talk about the people in the general population. So we start with Rattan. Rattan, how is the access of the people in general to the medical cannabis clinics? How is this somehow, are costs involved with that? In Canada, is there some funding from the government? How does it work?
Right. So I guess there's two ways that patients can get access to medical cannabis. Number one is they can be referred by their physician. It could be their family physician or their specialist to our clinic. That would be one way that patients can get access to medical cannabis. The second way is patients can self-refer. As I mentioned, in Canada, there is still quite a bit of stigma and still quite a bit of hesitation with physicians to get involved. Even with referring patients to medical cannabis clinics. Hence, we had the option that patients can call our clinic or go online and book an appointment. And with respect to cost, in Canada, our provincial healthcare programs cover the cost of the appointments. So the appointments are covered. The medication is not covered. So there are a few insurance companies in Canada that cover for a handful of conditions. Epilepsy, MS, cancer patients, HIV and AIDS patients. But again, that's what we're striving is to generate enough research, to generate enough data that we can present, our thousands of anecdotal cases, which eventually become evidence-based medicine. So some of these insurance companies and government policies will start to cover medical cannabis for more conditions than the handful that they're covering it for. We've seen specifically at our clinic, as I mentioned in the presentation, cannabis is definitely an opioid-sparing agent. We've also seen it been used as a benzodiazepine-sparing agent. And those are two medications that in Canada that physicians are hesitant to write those prescriptions because of the abuse potential and addictive properties of those medications.
Okay, perfect. I would ask Marcelo, because in Brazil is different. I understand that's more in the private doctors, and it gives the impression that really just part of the population will have currently access to that. Marcelo, could you bring some lights on that, how it works in Brazil?
Yeah, you're totally right. Unfortunately, it's still something for people that have money, basically because it's a product that it's imported, and with the difference on the currency, it ended up being really expensive. It shouldn't be, but it is. So it ends up that the government doesn't cover. Of course, people can go after, they can get a lawyer and go after their insurance companies and after the government. They'll eventually get some refund and some return, but for that you still need to pay a lawyer. So it still makes it kind of hard. So right now, for Brazil, it's for what we call Class A and B, people that can afford to pay the cost. The cost of 30 mLs of medication could go up to $250, and it's really, really expensive. So what happens is people end up buying it from the gray market or even growing in their homes, and it's not legal to grow cannabis in Brazil. So that's what we're doing right now. So we're doing kind of some advocacy work. This is when I talk about the market in Brazil, I'm talking now, I'm representing the Green Hub because the Green Hub is the company that works in the auxiliary market and doing all the advocacy. And now we have a project of law being voted here. So Brazil can at least start growing hemp locally. And I think when that happens, then we're going to have access to more cheaper medication because we're going to be able to produce and have the commodity here in Brazil. But right now, everything that comes from either 80% from the US and another 20% from Europe. And another problem with that is that we're importing CBD from countries that look into cannabis as a supplement. And here we're treating serious illnesses with that. So that's something that we need to solve as well. So we see problems for access when it comes to quality and when it comes to price. So there are two of the problems that we need to solve urgently. So even the products that are being sold in bulk and being sold in drugstores are expensive because the APIs are imported as well. So it's still a problem.
So
but that's
Marcelo,
something we're working. Go ahead.
Sorry. No, my question would be, so how do you see this expanding to the general population? Is this something that companies should take the social responsibility? Is the government that's going to take? Is going to be top down from rich class to lower class? How do you see this evolve in Brazil to reach a point that is similar to in Canada?
Yeah, right now it's going to be top down. So it's going to be only for people that can pay to have access. We see governments doing, moving, but I think it's still gonna be slow. But I think the way to solve that is only when we start working the commodity here in Brazil. It's only when we can start producing and growing for our own production. Then I think the access is going to be better. And then, of course, on the other side for the clinics, I think it's still a little bit. The consultation is a little bit more expensive right now because we don't have the volume necessary to lower down the prices. But I think once the market starts to get warmer and medications start to be higher quality and people start understanding better with the education that we're doing in water advocacy, I think it's automatic that the consultation prices go down as well.
Perfect. Thank you, Marcelo. Now I would like to close this panel discussion here from my side. Talk a little bit about the future outlook. How we see this market in the next 2 years, or even a little further than 2 to 5 years. And I would like to hear from Rattan. What do you think? What's your perspective for the future in terms of
Right. So, from a Canadian perspective, it appears that we're on a positive trajectory. At CannaWay, we do have short, medium, and long-term growth targets, and these targets are aimed at increasing quality of life of Canadians from coast to coast. And again, just to harp on the same 3 topics, our growth plan is specifically narrowed down to, ensuring all patients in Canada have access to a physician who has a specialty in medical cannabis. All patients have access to affordable medical cannabis, or that it gets covered. I think the real key for the future outlook is to incorporate the endocannabinoid system into medical school curriculums, and then also taking that one step further is incorporating it at like a basic science level or university level courses. And I think once we incorporate it into medical school curriculums and university curriculums, it'll go hand in hand with seeing an increase in research and publications and clinical trials, which will again drive anecdotal evidence into evidence-based evidence, or evidence-based medicine, which is what almost all physicians practice. So again, I think the outlook looks good. Again, the keys are improving access, education, and research. And we know, and we're driven by, and I think Marcelo touched on it, we deal with a lot of patients who haven't got symptomatic relief. They're at the end of the road, and they come to us, just for hope. They want to get better, but they've tried, 20 years, all sorts of medications, all sorts of very strong medications, and they come to us as a last resort, and we're able to provide these patients hope and see improvements in their quality of life And one thing that I didn't touch on in the presentation, but with respect to quality of life, it's not always, going from severe chronic pain to running marathons. We're talking about, small increases in a patient's independence, which plays a huge role when it comes to their sleep and their anxiety and their chronic pain, and so forth. So yeah, we're excited about for what the future has to hold for CannaWay, and hopefully we'll be coast to coast and international very soon.
Fantastic, Rattan. Thank you. Great points. Marcelo, so I turn to you and want to hear from you the future outlook for the Green Hub and the SAC initiative.
Yeah, I see a great future outlook. We're growing as a company. We're now reaching our Series A. So we're really excited to keep working. As market, I see a really bright future for cannabis here in Brazil. Eventually, when we start getting the regulations, the better regulation and better understanding. And I think we're going to reach that. I think we're going to reach a point in a couple of years that we're going to be able to start growing the commodity locally, and then give more access, and then start expanding the treatments and the number of clinics that we open, and the number of courses and the educational side. So it's yeah, that's what we really want is to give people access and quality of life. Like Rattan said, it's really important. We see people that when they say that it's chronic pain, it's not a back ache. It's something that takes them from work, takes them from taking care of their kids. We also treat a lot of patients with autism, and we see mothers, really happy, saying that their kids are listening to music and having better quality of life. So that's the future that we look at. We want to keep growing, keep investing, keep doing the right advocacy, keep educating not only doctors and patients, but educating governments and lawyers and judges, so we can have better regulations and give better access to all Brazilians in the future.
Thank you so much, Marcelo. Great point. So I'm gonna now open the questions for the public, and I have got some questions. Some people really, they got 3 times the same question. This one's gonna be the first. They would like to know, we talked about research, clinical trials, more education. So the question came is, are any of these organizations, both of you, either CannaWay Clinic or the Green Hub, working research projects or any other initiative with organizations in other countries, or in joint initiatives, I would say, not necessarily working just with your organizations? That they want to know. So Rattan, how is CannaWay Clinic work in this area?
So we don't have any joint projects with clinics or any affiliations outside of Canada yet. We recently launched a study looking at the effects of COVID on medical cannabis use, and looking at a variety of different factors, from the psychological effect, the effect if patients actually have COVID, effects on exercise, and effects on their medical cannabis use. But that's definitely something that's on the horizon. I think at CannaWay we would probably start nationally. We are in talks with a couple of large hospital networks regarding doing a hospital cannabis program, which would be one of the first in Canada, and then at the same time running research studies through some of these large university hospital networks. But outside of Canada, nothing concrete yet, but there's definitely some things on the horizon for 2021.
Excellent, thank you. And you, Marcelo, and the SAC initiative, are you guys supporting research? How is it?
Yeah, we're supporting research with local companies. We always do that. If people are more interested, they can contact me, and I'll open all the But what's happening, what's really interesting is that we see a lot of Canadian companies, manufacturers and developers looking into Brazil as as a good place to start. What's going to happen is that you see a lot of people working cannabis as a supplement, and I think in the future Brazil is going to go that way as well. Talking, bringing health and wellness to the table and having OTC products of cannabis. But right now, what Anvisa is doing is, like I said, is pulling the bar. And we see a lot of American and Canadian, European companies looking into what Anvisa needs in order to pull their bars in quality as well. So what's going to happen is really soon we're going to have more companies not only producing products, even if they're producing products for wellness reasons, they're going to pull their bars on quality, so they can work the over 200 million people that we have in Brazil, the possibilities of a new market being grown here in Brazil.
Okay, we have, I think, time for a couple of questions. One quick question here is regarding the dosage and the treatment. Is there currently a consensus on dosages and treatment for a specific illness? So across the board, across the world, there is already a definition of dosage to treat specific conditions, or it varies according to countries or jurisdictions? Rattan, what's your opinion on that?
In terms of standardized doses, we're still working on, what would be a standardized dose for, almost all conditions. Hence, we start at low doses and we titrate it slowly. That being said, there is one condition, Dravet's syndrome, which is an epilepsy condition, where the consensus is that patients would start at 0.25 or 25 to 50 milligrams per kilogram of weight. That would be the only one where there's a standardization of what the dose ranging should start at and go up to. But again, that's one of the initiatives of CannaWay, is to develop standardized treatment or standardized dosing protocols for a variety of different conditions. And I think as we get, we're at 13,000 patients right now. As that number goes up to 25 to 50, I think we'd have a much better viewpoint in terms of what standardized doses are for, chronic pain, anxiety, insomnia, and so forth.
Perfect. Any words on that, Marcelo?
Yeah, it was a perfect answer, Rattan. It's really the same. I think what we need to do is keep researching on microdosage. When we're talking about all the cannabinoids, we have to not only we still need to keep THC. Here in Brazil mainly we take THC from the discussion sometimes, because that's they put THC as the villain, but THC is also very important for lots of illness and treatments. And when you talk about THC, it's very important to look into microdosage. But it's really important to understand, right now, when we talk about the post consultation, the follow up that we do, that's exactly to follow up on dosage, exactly to see if that brand or that dosage is working on the patient. If it's not working, change it really quick and adapt. So until we research more, until we work more, until we collect data, that's the way we're gonna work, and observing and doing and collecting a lot of data so we can reach a right point.
Okay, so I have a final question here, and this is for you, Rattan. They said that cannabis clinics are definitely necessary because of few GPs have knowledge, confidence to prescribe. But many cannabis clinics in Canada are wholly or partially owned by licensed producers of cannabis, which presents a direct conflict of interest. And the question would be, is this something other jurisdictions like Brazil can avoid? So I want to hear from you, Rattan, if this is really a scenario, there are producers that own clinics, if this really presents a conflict. And Marcelo, feel free to jump in if you want to.
Yeah, there are definitely licensed producers or cannabis companies that own medical clinics. CannaWay is owned by a larger cannabis company involved in a variety of different streams, whether it's retail, clinics, or production. But that being said, I can speak for CannaWay at least. When we are prescribing products to our patients, we offer them a wide spectrum of products. So at CannaWay, we've partnered with all of the different licensed producers. And one of the reasons why is so that we can eliminate any sort of conflict of interest. And then two, there is a wide range of price points. So for our patients, we do offer not one product, it's typically 20 different licensed producers and a plethora of different products at different price points. And I think that's important to, one, determine which products show high efficacy and which products are effective, and also which products are not. Over the last 2.5 years, we have seen that certain products from certain companies, aren't of the highest standard and the efficacy sometimes lacks. And we see that when that product gets discontinued and we transfer them to another licensed producer product and their symptom scores improve. Again, I think the medical clinics in Canada are fairly strictly governed by the OMA, CPSO, and Ministry of Health. So in terms of looking at conflict of interest, at least at our clinic, it's very important to partner with all the different options or all the different licensed producers to avoid any such conflicts.
Marcelo, any thoughts on that you want to add?
Yeah, of course. We still don't have any licensed producers, and I think we will in the future. And I think it's going to happen the same way. And it's going to be, I see the way they other companies manage their clinics. I think and it's going to be the same way Rattan said. It's going to have to be really professional with training and to avoid all types of conflicts. It's not a problem that we're facing right now, and I think it's not going to be a problem in the future. And I want to answer a question, a last one, if I have a couple of minutes, from I think it's from Shelley, where she said, "How can you define personalized medicine as it relates to cannabis?" That's exactly that. What's happening is we have a couple of startups in Brazil. I don't know if that's happening in Canada so far, but we're doing DNA. It's a really quick, fast DNA check, which is going to give the results related to how your body is going to work with THC or CBD or CBG or CBN, which is going to be better. If the food you take is going to conflict, if your style of life. So what we see is that the future of cannabis treatment is going to be really personalized, even more in the future. So and that's the way I said. I don't think it's going to be a medication that you go and ask for a prescription and everybody's going to take 200 milligrams of whatever CBD for treating the same problem. I think it's going to be personalized in the way that you're going to do DNA tests, and the results is going to give you the better outlook on how you should be treated with cannabis.
Fantastic. Marcelo, since you brought the question, now, Rattan, what's your opinion on that personalization?
Well, I think Marcelo hit the nail on the head. At CannaWay, we pride ourselves in personalized treatment plans, looking at all the different factors that Marcelo had just mentioned. Eventually, I think we're going to be seeing, well, this individual's DNA will allow them to metabolize this at a certain rate. So why don't we prescribe this? That's really the direction that personalized medical cannabis is moving in. So yeah, I agree 100% with Marcelo.
Fantastic. Okay, so we are here up to the hour already, past a few minutes. There are lots of questions. We will try to address those questions, send to the respective panelists to get their opinions and come back to the audience. Claudia Ramos will organize this. I would like to thank you both, Rattan, president of the CannaWay Clinic, and Marcelo, co-founder of the Green Hub, for your time and your knowledge and providing this fantastic and very informative webinar for us. And also Rogerio, the chair of the Healthcare Innovation Committee, for helping us to put this program together. and all the team of the CCBC. Rogerio would like to say some words to close.
Thank you very much. No, it's a wonderful discussion, and we do have a lot of work to do at CCBC to bring this subject more into light, and hopefully you're going to approach it again in the Health Innovation Commission committee in the future. And definitely regulation, conflict of interest, education of physicians is going to be very, very important in Brazil, to make it very clear, because whenever you have pharmaceuticals into medicine, you have to regulate very well the risk of conflict of interest. So that this question and the way you guys approach it is going to be very, very important for the future here in Brazil. We are all learning. Thank you very much.
Thank you all.
Thank you.
That's it. Okay.
I just thought I would say thank you guys for the opportunity. It was quite a learning experience. And Marcelo, I'll definitely shoot you an email. I think there's some synergies that we can discuss moving forward.
Oh, of course, Rattan. Thank you very much. Yeah, let's set up a call so we can talk about the synergies. And thank you, Ricardo, and thank all the attendees.
Thank you, guys. Thank you.
All right.
Have a great day.
Bye-bye.
Take care. Bye-bye.